Welcome to the Level 1 refresher for the UHP MRI upgraded system. I'm going to be talking about a few things that you need to know if you're going to be working here as a researcher as a Level 1. So there are a few new procedures that we require in order to be able to meet the Health Canada and CHREB requirements for this particular MRI. One of them is that we need to be recording any system or health and safety issues related to this MRI. The recording should happen in the logbook. So this logbook should always be near to the console and generally open during the working day. It is labeled as logbook, and I put a post-it note to show exactly where we are in terms of the current logbook page. The purpose of it is to show for each participant scan, not scans of phantoms, but participant scans, the date, the time, the exam ID, the study node, the operator, and any notes about system or safety issues. So if you have no issues, just record the basics about your scan, as I mentioned, plus put in the check boxes no and no for system issues or health and safety issues. To be a little bit more specific about what it's intended for, system issues means you have a problem with scanning, you had to do a TPS reset, you had to do an emo reset, or there was some other error that was potentially preventing you from data collection. By a health and safety issue, I mean something where you or the operator believes that there could be something that would impair the safety of the participant. So for example, we don't have enough earplugs, we don't have enough ear covers, the participant thinks that they got a headache from this MRI, believes that the MRI was overheating them. Anything like that that you think we should be aware of, please make a note and use the appropriate checkbox to say, yes, there was something that happened. Don't be afraid of putting in something that you think is not significant, because we as the MRI center are the ones that will judge that. It's better to tell us than not to tell us, but that is what it's intended for. The one thing that I should make you aware of that it is not intended for is incidental findings. So if you have an incidental finding, don't put it here. You should do exactly like you were trained earlier to do. In other words, talk to a tech. If they think it's important, then you would raise this issue with the PI, and the PI would take it from there. So the other part that you should know about for the new procedure is that we now have a dual consent process, which means that there's one consent form that is a generic MRI consent form, which is specifically for this MRI. And then we would have the study scan consent form. So that means for your individual research study. So the process means that in addition to the consent form that you would normally bring to the research study, you would also use one of our MRI consent forms that is only describing the MRI risks and associated concerns. And the Level 1 researcher that has been trained like this and who already understands what MRI is about, therefore they've already had the level 1 MRI training, can sign that form too. So MRI consent form, research study consent form, both of these have to be signed by the participant, and the copy of the research study consent form is attached to the original of the MRI consent form, and then both are attached to the MRI screening form, and then they are put into the completed research paperwork folder, just like we had before. So by using this dual consent form process, we can save everyone the hassle of having to apply to Health Canada individually for their research study. So even though it's more paperwork for this particular part, overall it is much less administration for individual research studies. All right, so another aspect of our system that has changed since the upgrade is that we now have LED TV instead of the projector that we had before. And for the most part, this will not change the procedures that the level 1 needs to know. But one thing that you should be aware of is that the TV is not on when this system is not on, and also it's possible that when this screen is locked, then also the TV will not be on. So you need to log in, you need to wait for some setup scripts to run, and then the TV should be ready for you. Another thing to be aware of is that this TV is not automatically flipping the image left to right without our script being run. So this may not matter for any study that is only using it to show movies, but for those studies that need to have the text visible and readable by the participant, you should double check, because we do have a special software running so that it will flip it so that the participant can read the text. But you as a level 1 researcher will need to check that to make sure it's working properly. If it is not working properly, the only troubleshooting I want you to do is to reboot this computer and log in again and again check it. And if that doesn't work, then you contact me and I'll take it from there. Please do not try to change the settings yourself on this computer, because it's more likely that it will make it more difficult for me to solve the problem in the long run, or it will mess things up for another researcher. Okay, so one thing that you need to know is how the table recovery process has changed. In the situation for table recovery is that we're scanning a person, so we have the table inside the bore. And then because of an emergency, like the patient has panic attack or cardiac arrest or something where you believe that they need to have emergency care, then you need to pull the person out quickly. So the first step in the table recovery is to use the handle at the foot of the bed. Now, the handle has changed. Before, we had to squeeze it in order to be able to release. And now all you have to do is twist it. So I'll twist it, and then I will slowly pull it out. And pull it to the end of here. What you'll notice is that in order to be able to pull it out in an emergency situation, you have to pull it with the port and pull the ports right out. That is expected because we have no other way to be able to disengage the ports quickly. So that is normal, but we don't want to be doing that every day. We only do that for this table recovery procedure. Once you have brought it to the end, the undocking is very similar to what we have trained you on before. So you would potentially lower the table first to make sure that the patient is safe and not going to roll off the bed and hurt themselves in the process. And then you would undock by this second from the left pedal. And then you should be able to pull out, unless this is braked, which it normally is not. So you can pull out. I will not do it all the way, just so that I do not have to have the ports fall down. But that's the procedure. Now the redocking procedure, so from this point you would take them to the recovery area and you would make sure that no one comes into this room, so you would ideally lock this door. After the event is over and you have time to reset the table, then you would put this back in place. Just carefully align it as best as you can. And then, in this case, you would use the redocking pedal, which is the leftmost pedal. And now you would raise the table. And notice one step that we're missing that we had in the past was a power pedal. That pedal is no longer part of this table, so it's done automatically for you. So that saves you one step. So now we should be able to raise it. This is the manual way. but I would expect that the power would work now, and it does. So we no longer need the power pellet. So notice the doghouse is coming towards me, so I want to make sure that my ports are not in the way.
I was just looking at this chart. No surgery since last time.
And I wait until I can hear the click when it relocks, and notice that we do not need to press the home button with the new MRI. Next, I want to re-engage my ports. So this is what the port looks like when it's being pulled out. And I'll put it back in. It's just, I firmly push it back in on the track. Okay, so just to be 100% clear, the ports, if you need to reconnect them, it's just a matter of taking the whole port like this, sliding it in horizontally, and then firmly pressing on it. And you can see that after I did that, this showed up as green on the coils tab, and so it's connected. And likewise, now I do it for the other one. And again, I just press on it firmly, make sure this is green, and then I should be good to go. Another difference between this system and the older system is that our headset that we've been using, the Apotec over-the-ears or over-the-head headset, is a little bit too large for most of our participants in this head coil. So I would recommend that your default choice would be our new slim headset, which has blue for the ears, and this one does not have the band, and it's in design narrower. You can connect it the same way as the previous. So you just find the notch so that you can connect it together like this. The one thing that you need to be aware of, first of all, you should use ear covers just like we've been using in the past. So continue to use these on the slim headset. Like that. And these do not provide the amount of audio or ear protection from noise that we would like. So you should also use earplugs with this. So just use one of these with the participant as well as these. So these are just for the hearing of the movie and any other intercom interactions with the operator. You are still able to also use the other slim headset, which is only earbuds, but I would say that these are probably your easiest choice.